Hello, we're going to be talking about a cool mist aerosol. The purpose of a cool mist aerosol is to provide humidity for a tracheostomy patient. In order to do this, we're going to use what's called a 50 psi compressor. We're going to use a large volume nebulizer. We're going to need a tracheostomy mask. We're going to need a drain bag. And we're going to need some corrugated tubing. So, in order to adjust the pressure on the compressor, everything needs to be hooked up. On the large volume nebulizer, if the insurance company sends you 2 of these per month, then change it out every 2 weeks. If they do not, let's say you only get 1 per month, then you're going to want to do a maintenance, a disinfection and cleaning on this on a weekly basis. So what you want to do once a week, if you need to clean it, because you don't have another one to replace it, you're going to use a basic dishwashing soap, no lotion, no moisturizer, no fragrance, and you're going to wash this inside and out with soapy water and rinse it well. After that, you're going to want to soak this in a 1-part vinegar, 3-part water solution, that's white vinegar. Soak it 15 to 20 minutes, and then rinse well. When you're putting this together, you want to make sure that you have the bottom screwed into the top nice and flush. You don't want to cross thread it, because if you do, it's not going to work for you. It's the same thing when you're screwing it onto the 50 psi compressor. You have to be really careful not to cross thread these, and these are not easy to get on there, believe it or not. So you present it, and then make sure that it's nice and snug. You want it snug here and snug here. On the other side of the large volume nebulizer, you're going to have your corrugated tubing. Now, the Durable Medical Equipment Company will provide you initially with 100 foot of this tubing. We recommend that every week you want to change out the tubing and replace it with new tubing. So you're going to cut the tubing in 2 pieces. It's going to go, 1 piece is going to go onto the large volume nebulizer. The other side of the tubing will go to your drain bag. This is in case you want to secure it to, let's say, the rail on the side of the bed, which you can. Okay. On the other side, you're going to want to put the rest of your corrugated tubing. And on the other side of your corrugated tubing, you're going to want to put your tracheostomy mask, your trach mask. Okay, so again, you want to replace your corrugated tubing once a week. You want to replace your drain bag once a week. And you want to replace your mask on a weekly basis as well. You should have plenty of supplies sent to you on a monthly basis, at least if you're dealing with our company. We provide you with 4 masks, 4 drain bags, and 100 foot of the corrugated tubing. Once you have it all together, you're going to turn on the device. So we're going to turn it on here. Once we turn it on, we're going to adjust the pressure on the gauge. Typically for an adult or a pediatric patient, we're going to have the pressure at around 20 to 22 psi. In order to do that, it has to be hooked up to the large volume nebulizer. You're going to pull out here, and you're going to turn the knob until you get to the desired pressure. Right here, we're at 20 psi. Once you've reached 20 psi, you can push this back in place. When you hook it up to the patient, you want to make sure that you have enough flow to meet or exceed the patient's inspiratory demand. And what I mean by that, we do not want the patient to rebreathe their CO2, so there has to be enough flow coming out of here so that they can dispel the CO2 that the patient is exhaling and provide a nice, comfortable flow of air with mist to the patient. In order to do that, you can adjust the large volume nebulizer right here. If you go higher on the numbers here, you're going to get less of a flow. If you go lower, you're going to get more of a flow. I found that when I put it between 35 and 40, let's say more or less at about 37, I get a nice flow, or it's not too much and it's not too little. When you put it on the patient, you want to observe and make sure that upon inspiration, you see a little bit of mist coming out through this hole right here. If the insurance company, whichever insurance company you're dealing with, or your provider only sends you, let's say, 2 masks per month, then you only want to swap them out once you get them. So if you get 2 a month, you swap it out every 2 weeks. My recommendation is if you use this on a daily basis, that you take this and you wash it in soapy water every day, because it's going to get dirty quickly. Okay? The rest of this, at least once a week, change it out. When you go to cut your corrugated tubing, you want to place the scissors at the very middle of the connection between the 2 6-inch corrugated pieces. There's a little lip right here. You want to cut it right in the middle of that lip when you go cut new tubing. So you're going to cut a piece of corrugated that's going to go down. You're going to connect your drain bag, and on the other end, you're going to connect your tracheostomy mask. So replace this whole setup once a week. Your mask, you're going to want to wash this every day with a basic dishwashing soap and water. Keep it clean. The patient is exhaling into this mask all day long, and so that's going to get dirty pretty quick. So when you actually turn this thing on and put it on the patient, you want to make sure that you have enough flow coming out of here to meet or exceed the patient's inspiratory demand. And the way you can determine how much flow is coming out of here is by taking this blue dial and turning it in one direction or the other. So just to recap real quick, replace your whole circuit on a weekly basis, wash this every day, and once a week you want to disinfect the large volume nebulizer the way I just described. This filter here, you do not wash this filter, you replace it. The manufacturer actually says 6 months to a year, so it all depends on how dusty the environment is. You don't wash it, you replace it. On the back of the machine, you're going to have another filter. This is it right here. Dust will accumulate on one side. I recommend it on a weekly basis. If you use it every day, you take your filter out, you wash it, clean it, dry it, and put it back. So once a week. This concludes the 50 PSI Cool Mist Aerosol instruction.